And welcome back to another episode of Fully Stoked Podcast. I am your host, Sarah Stokes, and I'm here with two new friends, Jeff Krafft, physical therapist, and Kallie Marshfield, and she's an occupational therapist. Is that right?
Yes.
All right. So welcome, guys. Thank you so much. They're coming to speak to us about myofascial release therapy, and I'm so excited for this topic because it's new to me, but it's sort of in my realm because I kind of like the wellness and a little bit natural kind of stuff, right? Instead of just taking a pill for everything. I think this is going to be exciting for me. So watch out, husband, because I might be spending some money on it. All right. So welcome, guys. Let me just introduce myself. In case you've never seen Fully Stoked before, I am Sarah Stokes. And by day, I am a lender. I help people buy homes and all their home financing needs. But what I really like to do is connect experts in different areas, entrepreneurs, small businesses, to people like you, because it's hard for people to really understand everything that everybody is an expert in. And this is a great way to bring you guys knowledge and connect you with some great people. And you guys live in Union County, North Carolina, and your office is, tell us where your office is.
It's in Monroe, North Carolina, right close, about half a mile, if that, from Atrium Health Union Hospital.
All right, so right in Monroe, yeah. I grew up right down the street from that hospital. So
Okay.
yes. And so one thing that I keep asking Jeff and Kallie is, I kind of understand what myofascial release is, but it's new to me. And I've been in this realm of, chiropractic and holistic care for a little while, and I really have just heard of it. So tell the viewers what it is, if you don't mind.
Sure. So myofascial release is a type of therapy that works on the fascia in your body. So what fascia is a type of connective tissue in your body that is made up of basically three type of components. There's a collagen, an elastin, and a ground substance.
Okay.
But fascia used to be, that's just the stuff that just is in the middle of everything. It doesn't really mean anything. It doesn't help. It doesn't have any role in anything. But they have now found that it plays a crucial role in our body and how we do things. So it's a 3-dimensional type web.
Okay.
And it surrounds both your skin, muscles, organs. It even gets down to the cellular level now. And
Really?
it goes into the actual individual cells. So
wow.
But it spreads throughout the whole body. That has a viscoelastic type feeling to it.
Okay.
And its function is really to resist a sudden applied force. So like a protective mechanism at sometimes too.
So if you got punched in your belly, that might be one of the things that helps protect, like your muscles, of course, too. But
yeah, obviously.
Okay.
But as a result of that, there's a lot of different forms out there of myofascial release.
Okay.
And some of them work better than others. The ones that we practice is from the pioneer of it basically was John Barnes.
Okay.
And the whole premise behind it is a low load over a longer period of time produces better results than something short and fast and hard.
Absolutely.
Think about it, the system that you're trying to address, if it's set up to resist a sudden applied force, the last thing you want to be doing is going into it really hard
Sudden
and fast.
applied force, right?
Yeah. So, but collagen, it provides your support, shape, and mobility, and stability. It's kind of like your ligaments.
Okay.
And then you have the elastin part of it, which is the flexibility. And then you have the ground substance that makes up the bottom. That's like your whole little extracellular matrix in your whole body. And its function is kind of to provide cushioning, and it surrounds the cells as well. So the cells are going to bump up against each other, and that stuff in between them is that ground substance. So what we're trying to do is address that through long loads, manual therapy, hands-on stuff.
Right.
So typically what we tell people is, our treatment plan is we are spending an entire hour with you hands-on. And when we're releasing an area, we spend about 5 to 10 minutes on that area. So rather than massaging and moving, we are holding and allowing that fascia to really open up and respond to what we're doing.
Okay. So one entire hour. So I know other people are going to have this question. How is it similar to massage? I mean, obviously you're spending an entire hour, but you're applying pressure. And then how is it different? Because would a person also have massage therapy in addition to myofascial release therapy? Is it therapy?
Yeah.
Okay. Yeah.
So we have people who come in and get both myofascial release and massage therapy.
Okay.
We also have people who are coming in and getting, chiropractic and myofascial release. Massage is more muscle based. So they are massaging the muscles, whereas we are focusing more on the fascia and elongating that fascia and helping it to rehydrate.
So it feels differently to you because you know what it is. We probably wouldn't know the difference.
Yeah, you probably would, because we're not trying to get in there and move a whole lot and trying to dig and get into those little sore areas. So one way you can kind of picture the difference between massage and myofascial therapy is, let's just go back to that elastin material. When you stretch a rubber band, it'll stretch out, but you let go, it's going to go back to it.
Right.
So when you start talking about collagen and you're trying to stretch that out, so that's more like a plastic. If you deform that plastic, it's going to stay. You can't just put it back to its same shape again. So massage kind of works that way. So you can get really good results and you feel good. Sometimes they don't last as long because you're basically pulling the rubber band, and when you let go, it goes right back.
Okay.
With myofascial release therapy, what you're doing is you're getting down to that collagen part. So you can deform that and get it out of the bunched up position that it's in and start letting the body to relax. Then you tend to get more lasting results.
Okay. So you told me about collagen and elastin. Is there anything that you do to manipulate that ground substance you were talking about? Or does it just naturally?
It's just part of the process, actually.
Okay. Wow.
And I think most of the people that we're treating tend to feel a melting sensation. A lot of times we hear that. Sometimes we'll hear a stretching sensation. So it depends on where we're working, but a lot of people really feel melting,
So where do you find, so when I have a massage, I often have a lot of tense muscles in my neck here. This is I know it's different for different people. Do you have one area of the body that you find a lot of people have the myofascial release needed, where they have the bunched up?
Sacral area is
pelvis.
What I would say. Yeah.
Really?
Yeah. So a lot of times, if you think about how your body is, our hips are our base. If your hips are off, if you have a rotation or you're unbalanced in any way, it's going to throw your neck off. It's going to throw your shoulders off. So if you're standing and your hips are off, your body is going to try and right itself.
Right.
So what we do is we fix typically, we don't have a one size fits all by any means, but I feel like we have to treat the hips first and then we can address the neck. And sometimes if we treat the hips, the neck and the shoulders loosen on.
Okay.
Think of it like that song, the knee bone connects to the hip bone, everything's intertwined and interconnected.
Yeah.
So if you have something that's off over here, it affects that side.
Yeah.
A lot of times we see a lot of pelvic obliquities, as they call it, where if they're lined up and they're great, they're here, but a lot of times one will be tilted a little bit forward, and that can end up feeling like one leg's shorter than the other or one leg's longer than the other, depending how you look at it. So, and then you start getting some habitual walking pattern that translates up and that causes another problem somewhere else.
So what are some examples of reasons why someone's pelvis might be off balance? Like birth?
So, yeah, and I think our holding patterns, So this is a really drastic example, but I had a gentleman who had a foot drop. So what that is when their toe, drops due to weakness. So because of that, he had to bring his hip up so he's compensating for the way he walks. So then over time, he has a hike. So his hip comes up a little bit more automatically. And then he has a tilt. So we've been working really hard on just fixing that. But then he has to do some work to walk properly too,
Right.
So once he comes in and I kind of align him, then I say, okay, now I really want you to pay attention to how you're walking.
Okay.
Let's not walk the way that we know.
So Jeff is a physical therapist, you're an occupational therapist, and that's where your training as a physical therapist and occupational therapist also come in, right? So it's not just the myofascial, you also have expertise in other areas. There we go. All right. So we were saying before my husband called, it'll edit it for us. Sorry about that. He's the only one that can get through on Do Not Disturb. I should probably tell him. So I'm going to pause here. I'm not going to mess with that. I'm just going to tell him to leave me alone. He has my calendar, but I think he's just probably worried about me because he's called me a couple of times and it's still going. Hey, Hey, babe, I'm doing a podcast. I just wanted to tell you because you keep calling and it keeps popping me. Gosh, it's okay. I got it on the calendar, or maybe I didn't send it to you, but I do have you on speaker with 2 people here, so I love you. Okay. All right. Talk to you later. All right. Bye. He thought I was dead or something, He was like, you gotta tell me. Okay.
So what part?
We were talking, let's go back.
Start the whole thing.
Yeah. So I think, when I was talking about, yeah, it's on Do Not Disturb. Sure, it's not an emergency. All right. They'll go together. It's coming. Okay. And we're back. 3, 2, 1. Okay. So we were talking about how your expertise in physical therapy and your expertise as an occupational therapist, you guys built upon that with the myofascial release training with John Barnes, myofascial release training. Yes. And how when you're working with somebody, you also have to use your PT, right? Your occupational therapy to help them later on. Then you started telling me a little bit about the anterior and what does that mean?
A lot of times we see most people have, a majority of people have a tilt forward of their pelvis. It could be one side more than the other, or it could be both. And that kind of comes from just our society of just being forward based.
Right.
Cell phones, laptops, computers. Heaven forbid you work in a job that's an assembly line where you're doing this all the time.
Right.
That type of thing.
Repetitive movement.
Yes. And those cumulative traumas just add up over time and cause stresses and pains and those type of things that myofascial release helps really well.
What about hands? Because so many people are on their computers and their phones. Do you see wrist carpal tunnel? Does that have anything to do with myofascial or anything like that?
Yeah.
Okay.
So I always say jokingly that the hand therapists are going to have a future forever because all the texting that we do.
Exactly.
People are going to have some thumb arthritis when they get older.
And you were saying like it could, so something here, trauma here, repetitive movements here could actually affect other places in your body too.
What I find is, yes, here, but it stems here. So with that repetitive movement, you're sitting here. If we do something like an arm pull, which is something simple, like you're just pulling, distracting lightly, it opens up this area, but then you can also come here and just lightly pull here.
So you're working multiple places at the same time.
Elbow.
That was a good demonstration. I think I need to see it in person. So that was helpful for me to understand. So if someone had massage therapy, it's not going to impact or in a negative way impact your work, right?
No, matter of fact, they complement each other.
Okay.
Yeah.
So,
okay. Yeah. And, we talked about chiropractic too. It's the same thing. The chiropractics, I have great respect for them. They're moving the bones. However, if you move the bones and you don't move the fascia, the bones are going to go right.
Could go back.
So we complement each other in that way, where if you go to the chiropractor and then you come to us, we can help loosen that fascia so that you're not going to the chiropractor as much, or you're not needing to.
Right. Kayla Huntington is the chiropractor in one of the groups, and then Shannon Conley is a massage therapist too. So it would be interesting. So if I wanted to go get all of those things at once, and then I guess I would just, say, well, Kallie was saying blah, 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 blah. And then I'd go to you and say, Shannon said, or Kayla said, is that how it would work? And then we would just go through it like that, like a plan. So people do have to be involved with their treatment. They can't just blindly go and take a pill, right?
Exactly.
Correct.
Yeah. And I think that's what's so cool about the wellness. You said this is more wellness. This is not, it's a way to prevent, I guess, disease in your body. I think it's just so important. And it's holistic. You're not taking medicine. You're not taking, what are those things called? Pain blockers, things like that.
Opioids and everything.
Yeah. And I think what frustrates us too is that's a Band-Aid.
Yeah.
But what is the root cause? What is going on in your body? Pain is just a message saying something's wrong.
Right.
So how do we address it and how do we fix it?
Yeah.
Rather than just putting a Band-Aid on it, So, that's what I think all of us in the wellness space, we want to make it better so that your body is no longer hurting and no longer in a bad position. I think healthcare, a lot of times we just want to put a Band-Aid on it and not fix the actual cause.
That is true.
I think that we've gotten away from, in healthcare, the power of human touch and how much that plays into a role of healing.
Yes.
And we try to make sure that this myofascial feeds right. Quite the opposite, because your hands-on manual therapy, 1 hour, you see some tremendous results with that. And healthcare's kind of gotten away from that.
Right.
It's like, here's the latest and greatest, machine to do this, or here's the latest and greatest medication to take.
Right.
And it's because everyone wants it now
Mm-hmm.
and instant gratification.
Yeah.
And it doesn't always happen that way.
Right.
So you got to put, like you said, some effort into it and take some ownership of your own health.
Mm-hmm.
But
I think if people are, so many of my friends are eating, trying to eat organic and whole foods and no seed oils. And so if you're putting that much effort into it, it's probably worth listening to this podcast and maybe going to meet you guys. How does that work? If somebody was interested in working with you, would they call you, go to your website, come in for like a session where you just kind of talk about their problems? How does it work?
All of those things.
Yeah.
So we have a phone number where they can call.
What is that? Go ahead and tell them.
It's 704-595-2111. You can also go to reliefmfr.com. That's our website. We do consultations, and those are free. So it's a 30-minute session where we just talk about what somebody's issue is and how we can help that.
Okay. So, and they can schedule it online or call you to schedule that?
Either way.
All right. Well, I'll be calling you.
That sounds good.
This is exciting. It's something new for me. So I was going to ask you, Jeff, tell the viewers a little bit about your training, because physical therapy you have 30 years as a physical therapist. So you were trained in, Western medicine. You're not totally holistic, just wellness. Yeah.
So I got my physical therapy degree from University of North Carolina at Chapel Hill.
Wonderful.
And at the time, it was 7 years of school, or 6 years at that point, because it was just a master's level. And around 2000, or shortly after 2000, they switched it to doctorate.
Yes.
So now it's 7 years to be to your physical therapist degree.
Yes.
And similar to occupational, they've kind of gone into a doctorate.
Oh, really?
As well.
Yeah. I didn't know
have a
that.
master's, though.
Yeah, that's okay. You guys both have a lot of experience.
Yes.
You've been doing this for 30.
So I have a lot of background in outpatient therapy.
Okay.
And started there, as well as in the hospital and acute care. I did the nursing home type of thing too, and been doing the home care now for a little over 10, 12 years now.
Okay.
So it gives you a well-rounded, ideas and treatments that you can.
Absolutely. You've done it. You've done a lot. Yeah.
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 And you've seen a lot of stuff. So you
Yeah.
kind of know. I've seen things come and go.
Yeah.
Things are cyclical in this life.
Yeah. Yeah.
One thing that's not popular now, suddenly 20, 30 years from now, is like, you know what? That's back in again, or that really worked.
Yeah. Right.
But you're right with the Western medicine attitude or teaching philosophy. With myofascial release, it's a little different. And then when it first came out, people were like, that doesn't make sense. But now they've got scientific studies showing it's beneficial.
There's a whole board that studies fascia and makes sure that we are looking at how fascia affects the body.
So this is it. Would you say it's up and coming? Is it just cutting edge? Is just kind of new? I've just heard of it, and I've heard of it twice now in the last year.
Yeah, I think a lot of people have not heard of it because of that. It's been around, like John Barnes started it back in the 60s.
Okay.
And even before him, there was people who were researching it. But technology has gotten better now to where you can actually see some of this stuff in the body, and they just didn't have that capability. You can't see fascial restrictions on an X-ray or an MRI or a CT scan or EMG or anything.
Right. Okay.
And now they're starting to get to where you can start to see some of the stuff at the microscopic level. So you're starting to say, well, gosh, this is affecting that.
Yes. Yeah. All right. So tell us about your experience and your 15 years of home health occupational therapy. What does that mean, home health? Because you just said that too. Home health versus in the hospital, inpatient.
Yes. So we go into people's homes and we're teaching them how to live in their home safely. So, we're giving home exercise programs, but we're also making sure that they can get to the refrigerator, or they can get from the couch to the bathroom safely.
Okay.
So it's a lot of what we do. But yeah, I started my degree at Springfield College in Massachusetts. I did 5.5 years. So I did an accelerated program. But I found myself in Union County and I have loved it. My second job as an occupational therapist was home health. So I've been an occupational therapist for just over 15 years, and I have spent a lot of time in home health.
That's interesting. Going into other people's homes. I bet you've seen a lot. Just
It's very interesting.
I bet so. Well, I got a little note here. This is very interesting. I remember you telling me this. Army National Guard medic for 8 years, and you were the first non-commissioned officer assigned to North Carolina Field Artillery Unit. What is an artillery unit?
Those are the big guns, the cannons. Yeah. So my husband's also National Guard, so I went into the National Guard excited. Being a medic is awesome. I mean, I really enjoyed it. We are kind of, the people who are pulling the guys off and fixing their, their gunshot wounds and things like that. So very different from what I do now.
Wow. Yes.
But I enjoyed it. And I joined the field artillery group, first female. I will tell you, I was breastfeeding at the time.
What?
So that was a whole new level.
Yeah.
I feel like I exposed those men to a lot.
Yes. Well, it's probably good for them.
It is. And one day those men will be fathers themselves.
Exactly.
So it's a good experience for them. But I got out after 8 years because my husband was in, and it's tough being dual military and having 3 kids. So we had 3 kids at the time.
Were you stationed at the same place or?
Yeah, the field artillery unit in Charlotte. So it's right off of the airport. He was a supply sergeant there. So we got to work together for a little bit.
I didn't even know that was there.
Yeah. Yeah. It's neat. So it's right off the backside of the airport. So you can watch the Air Force jets take off sometimes.
Where have I been? I'm in the airport all the time. That is really cool.
Yeah.
So if we were to have a scary situation in the world, we would at least have the National Guard Field Artillery Unit close by.
Yep.
That would probably benefit us.
There's actually one in Monroe too that's an offshoot of that one. So
I think I've seen that.
Yes.
Is it near the hospital as well?
It is.
Okay. All right. I was always wondering. Okay.
Yeah.
Wow, that's interesting. Okay. All right. So why did you guys decide, and I'm not sure you really left traditional healthcare, but what brought both of you into myofascial release? What is the word I'm looking for? It's wellness. It's not alternative. It's just more wellness. Integrative.
Yeah.
Okay. So what made you decide to move in that direction?
Well, I started taking, as part of keep your license, you have to take continuing education classes throughout your career. So I got introduced to John Barnes and his philosophy and myofascial release probably 15, 20 years ago. Started taking some of the classes there and thought, well, this is great stuff. Started incorporating in when I could with the appropriate patients, and just kept taking those courses over and over. And then I finally met Kallie, and so introduced her to it. And I've been waiting to find someone with a similar mindset and say, okay, yes, this is what we want to do. And that's how Relief Reimagined kind of happened. But
Jeff introduced it to me. So I have felt lost in occupational therapy for a long time. I think Jeff can attest to this. We've been coworkers for 15 years. I've always felt like I'm missing something. So Jeff introduced me to myofascial release. And I remember sitting in the class and it being like, this is it. This is what I've been missing.
Oh, wow. I love that.
Knowing that this is what I want to do. This is how I want to help people. So we got back from that first class and I was all in. I'm like, I'm going to treat all my patients. I'm going to do this.
It's awesome.
But we found that it's hard in home care, I mean, we have
general.
Yeah. We have the productivity that you have to meet every day. So spending an hour with each patient is not feasible.
Okay.
And then being in a home, it's hard to be grounded. It's hard to, cut down the noise. It's hard to have that person.
Right. Okay.
There's a lot of distractions because you can't control the environment in someone else's home all the time.
Okay.
Right.
So.
Okay.
And
I get that.
I think too, healthcare wants to put us in a box. So they want to say, well, this is what you should be doing.
Yes.
So if you step out of that box, you raise some red flags, so there are people asking questions. Why aren't you doing this? Why are you doing that?
Sure.
So we found it really hard to implement in home care solely. So we started actually a year ago. Exactly.
Almost.
We started saying, we need to do this on our own. We need to be away from the hospital. We need to just do it.
Okay. So you're entrepreneurs now.
Yes.
Yes, we are.
Wow. And that's a whole nother level, right? Because you're generating your own income.
Yeah.
And you have to figure that out. So help them out, people. Okay. Spread the news and share this podcast with your friends. I'm telling you, I mean, I just think there's something to it. I asked them about doing maybe a workshop. I said, would there be a way for you guys to give us a couple of exercises. And just tell them what you said. You were saying it's better to be, because you're hands-on, right?
You're right.
But there might be a couple of things you could show
There's
us.
some things that we have people do for self-treatment at home. Once we kind of get going and get things started in the right direction, so that you can keep advancing it and maintain those benefits and results.
Right.
So those are simple things that you can show anybody.
Yeah.
With that type of stuff. So, and you don't necessarily need a lot of tools or anything like that to do it. You just need to know what to do.
Yeah. And I think Jeff and I really like educating people. I think we like, getting out in the community and talking to people. So I think we had talked about a workshop at that point, but summer kind of has gotten away from us a little bit, but we would like to do that.
You ever heard ain't nothing to it but to do it?
Yeah.
All right. So they're going to be having a workshop, and we'll let you know when it is.
No pressure.
I'm going to help them because I do events all the time. So I'm going to help you with an Eventbrite and a Facebook event. I'm going to help push it out, and maybe we can move this up to fit the timeline maybe a week or two before the event. I really think this is very interesting. And I told Kallie, I told her yesterday and I told her today too. I was like, I know you've explained this several times to me, but I just can't wrap my head around what myofascial release is. What is myofascial? What is it? What is fascia? And fascia. And so they've explained it now like 4 more times, and I think I have it. But for a lay person who's not in the healthcare industry, who doesn't have the degrees that you have, it's difficult. It's really difficult to wrap our head around it. But now I think I've got it. And I think if you could spend a few minutes with somebody in a workshop setting and explain what it is, I think people will be like, yeah, I'll give that a try. Why not? If it's a free first session, why not? Like let me check it out. It can't do anything but help me. So earlier you were telling me, okay, I read something about athletes. I think maybe if you've heard of it, you may think it's just for athletes, but it's not just for athletes. It's just for any of us. You said something about trauma. So it could be physical trauma, like what? Like
anything. I mean, even surgery is a trauma because you're getting cut. And the body has to heal, and it's going to leave a scar. Collagen is what gets laid down to fill in that thing. It's in your skin, all that. So if that's too tight, people have C-sections.
I have one,
that.
Yeah.
So that kind of thing can get really tight, and it just binds down. My wife had one, and for years and years and years, she would still feel something on this one side. And until it finally able to address it through some myofascial work. But it's not just people kind of say to us, we see the people, I've been to therapy, I've done the injections, I've done, the chiropractor, I've done all these other things, and they're telling me I don't know what else to do.
Yeah.
So we'll see people when they're at their wits' end, basically.
Because they find you after all the other things. Okay.
It doesn't have to be that.
No.
It does not have to.
Which is why you're getting the word out. Yes.
And I will say, trauma on a physical level is one thing, but also mental trauma, so abuse cases. And this is stuff that we don't talk a lot about, but childhood abuse, you think about how you have to protect yourself and what happens with your body. Your shoulders come up. Maybe you want to be in a fetal position, so you're tight in your hips, and over time that trauma can cause issues in our body.
Physical. Okay.
Yeah.
Your body remembers that kind of stuff.
Yes.
Like if you're in a car accident and you get whiplash, everyone knows if that's happened to you, you're always looking in the rearview mirror when you stop now. Make sure someone's not going to hit you.
Yes.
So it just remembers those traumas. And then you see someone and you start tensing up. And then the body starts to think, well, that's the normal position I need to be in. And so you're constantly in this tension state.
But it's not good.
It's not good because it causes pain and discomfort in all kinds of different areas.
So that book, The Body Keeps Score, I think.
I love that book.
I know, I do too. But it's true. Like, I think when we're not consciously aware of it, our body goes back, it reverts to those same positions that are not good for us.
A good example that you can take home that's kind of a thing is about how myofascial works. And this kind of goes into, well, I'm hurting here. Why are you working up here? Why am I addressing this? Because think of it as this way. You're wearing like a snug sweater, and you happen to walk by something, you catch it, and it gets caught.
Yeah.
And it pulls, and you feel like, I'm having pain up here. This is my shoulder. I can't do it. Well, that might be where you're feeling the pain. But where the restriction or where the problem is down here. If you release this, then suddenly, I can do my shoulder again
Yes.
and that type of thing. So it's not always where you feel it is where the cause is, like we were talking about before.
Yeah.
So that helps people kind of visualize.
That's good. That's really good. Yeah. I would use that in your workshop,
I
please.
actually just posted something on that on
Yes,
my
you
Facebook,
did.
on the
Yes,
Facebook
you
too.
did.
So
Okay. Oh, they do have Facebook and Instagram. So follow them. I'll tell you what it is, and I'll also put it below. It's Relief Reimagined MFR.
Mhm.
Yeah. And then, so check below. You can just click them and follow them on both of them. All right. So there's a nervous system connection. I guess, I mean, that kind of covers, right? The physical and the emotional, all of that. Fight or flight response is kind of what you were talking about. How fascia influences the nervous system. Is it a physical influence, you think?
Yeah.
It's pulling you? Yeah.
It can be. Actually, it definitely is because fascia is innervated with very rich sensory nerve endings. And there's a constant stream of information from your brain to your body trying to get these things so you can work on keeping your posture, keeping your balance, and moving correctly and those type of things. So if that gets out of whack, and let's say you have a trauma somewhere, that restriction can get in there, and you can actually they've measured this. You can have up to 2,000 pounds of per square inch of force on a certain spot. That's a lot. That's a ton. If you have that like in your neck,
literally,
yeah. So that can break down stuff.
Wow.
And it starts to restrict things, and the ebb and flow of the information can get interrupted. The fight or flight thing is your autonomic nervous system. That's the stuff you don't have to think about doing. I don't have to think about breathing. I don't have to think about my heart rate, heart beating, and that type of thing. But if you start getting restrictions somewhere, it's starting to cut down the flow of that kind of information. And then it can affect digestion, your blood pressure, and it keeps you in this constant fight or flight symptom because the information is not getting there and the body doesn't know how to process it.
Okay.
And not only that, but medications. If the old hole to go into your cell to get the medication in there is supposed to be this big, and now it's this big, it's not getting in there like it should.
Yeah.
So
makes sense. It does make sense. Okay. So you've been together for a year with your business. And what do you think is the biggest hurdle that you need to overcome? I know what I would guess. It's just making me understand and the rest of us understand what you do. But
I think that is a huge factor. I think too, giving up so much, and being on the same page. Jeff and I we have the same passions, but we're different, and we do things a little bit differently.
Sure.
So trying to do things the way that we would do things, but do them together, I think is always a struggle, and so I think too, financially, it's huge financial stress sometimes building a business. And
absolutely,
I am leaving the hospital. So that's always a stress too, but it's been a journey.
Yeah, it's never a dull moment.
Right.
I mean,
right.
we'll scream at each other, we'll yell at each other, and next thing you know, we'll say, you know what? After we talked last night, I feel so much better.
Just releasing it.
Yes. It goes back to that fight or flight.
Yes.
Fight a little bit, and then I'm like, okay.
Yes. Okay, what's one thing about fascia? These are rapid fire questions, by the way, before we end up. So one thing about fascia that surprises almost everyone.
I think that people are surprised at how much of it there is and the role that it plays once they learn about it, and how important and how impactful it can be on your just day-to-day life, from just chronic pains to like fibromyalgia, chronic fatigue, those type of things, and just how much it plays into that kind of stuff.
Okay. Yes, I agree. Yeah.
I think too, when you're working on somebody and you're touching them, you're working on their hips and they're feeling it in their neck, or, that surprises so many people. They're like, oh my gosh, I'm feeling that up here. Or, ooh, I just felt it release in my upper neck.
And you're not working anywhere close to the upper neck.
I'm touching them there,
I'm excited to see what this is all about. So I don't even know where I might have like what would you call it? A web, restriction. How do you do that? Do you feel around, or do you see the way somebody walks and you can identify it, or
all of
both? Yeah. I mean, sometimes you can feel there's a thing called trigger points, and massage therapists and medical field know about these type of things. That's where sometimes they'll put an injection in it, and that will help release it, but it's temporary. Massage, like we talked about the rubber band versus the plastic thing. can provide results, but sometimes you have to have a little bit longer lasting thing.
Okay.
So you can palpate those, you can feel those things.
Yes.
And take care of that. But you can't always feel some of the other stuff. You know, like I have this neck pain or I have a headache, or I have TMJ and all that kind of stuff that's just constant. And you don't put one and one together and say, and some of it's just no fault of your own. You just don't know.
Right.
And until someone can educate you.
Right.
Yeah. And I think when people come in, we look at their posture, we see where your holding patterns are, but then as we're doing that first session and we're putting hands on you, we can feel, oh, you're tight here. Oh, this isn't moving quite like it should. And so it's both, I mean, we're seeing how somebody's coming in and we're using our knowledge, if this is tight, then this is going to be tight, but we're also feeling it, because not everyone's the same.
Yeah.
They have similar patterns, but
some people you can just see. I mean, the forward head stuff that we have in this country now, you don't have to look really hard. You see a lot of people with that.
Yeah.
Well, what's one habit that people can start today to care for their bodies?
I would say the forward head, I mean, making sure your shoulders are back, making sure that your neck is up. So we took a pelvis class, and in that class, they said that when you look down, that's putting about 60 pounds of pressure on your neck. Wow. So, and honestly, the tech neck is what they call it now, that bulge that we used to call, I don't even remember what we call it. Yeah, but we used to see elderly people with it. Now we're seeing 20-year-olds, so really thinking about where your head is in space is important.
All right. So if listeners remember only one thing from today's conversation, what would you want it to be?
Well, I think hopefully they've learned a little bit about what fascia is and how it plays a role in our everyday lives. But I think there's so in this Medicare or medical world now, everything's protocols. If you don't fit into this thing, you got to do insurance companies make you do that.
Sure.
You got to go try this, and this before we'll let them do that.
Right.
And don't get stuck into a protocol and just this tunnel vision of this is what I'm looking at and this is all I can do. Our bodies are interconnected and they need to work together to be efficient. So, anything you can to help reorganize that and put you back into a position that your body wants to be in, the body will go there if you let it.
Yes.
So big one is don't be afraid of going outside the box a little bit. Like if you have cancer and the best cancer specialist is in Philadelphia,
right?
Don't feel like you can't go there.
Right.
You can go find the people that can help you the best.
Yeah.
And that's what we try to do.
That's good advice.
I think for me, the biggest thing is just because somebody tells you that there's nothing else that can be done for your body doesn't mean you have to stay in pain. Like Jeff was saying, go find somebody that can help you. I mean, we'd be happy to see you and treat you. Don't stay in pain.
Yeah. Yeah. So the workshop, I will let you know when that's coming up. And also follow them on Instagram and Facebook, email info@reliefmfr.com. And I am just so happy to finally understand what it is that they do and to start my journey. I don't know, maybe we'll do a part 2 and I can just talk about, whatever you guys find in my body. Who knows? Because I'm pretty healthy, but there's always something to improve, right? Absolutely. Is there anything else you guys want to share before we go?
Well, I want to thank you for letting us broadcast out to everybody.
Absolutely.
So find us a little bit easier.
Yes. Yeah.
I'm just excited to be here. I think this has been a wonderful conversation.
Me too. Me too. All right. So until next time, guys, we will see you. Thanks.